Welcome to Disability, Community and Healthcare. Today we're diving into an important topic, recognizing the early signs of autism in toddlers and children. Early detection is crucial for timely support and intervention. Be sure to check out our previous videos on autism and its impact on adults. Today we'll explore the early signs of autism spectrum disorder, ASD, and the actions to take once these signs are noticed. ASD is a developmental disorder affecting communication and behavior. If you notice these signs in a child, it's crucial to pursue a professional evaluation. Some early signs of autism can be observed in children as young as 18 months. These signs can vary widely, but there are some common indicators to watch for. For instance, a child may not respond to their name or may avoid eye contact. These behaviors can be early red flags for autism. Other signs include repetitive behaviors, such as lining up toys or repeating the same actions over and over. It's important for parents to be aware of these signs and to seek professional advice if they have any concerns. In the following chapters, we will delve deeper into these early signs and provide you with more detailed information. One of the earliest signs of autism is difficulty with social interaction. Here are a few red flags. Limited eye contact. Babies with autism may not make consistent eye contact with caregivers or avoid it altogether. This can be one of the first signs that parents notice. Eye contact is a fundamental part of social interaction, and its absence can be a significant indicator. No response to name. Around the age of 1, most children will turn to respond when their name is called. However, children with autism may seem unresponsive or uninterested. This lack of response can be concerning for parents and is often one of the reasons they seek professional advice. Lack of interest in social games. Babies may show less enthusiasm for typical social games like peekaboo or smiling back at people. These games are crucial for social development, and a lack of interest can be a red flag. Parents might notice that their child does not engage in these interactive activities as expected. Preference for solitary play. Children with autism may prefer to play alone rather than with others. They might not show interest in sharing toys or engaging in group activities. This preference for solitary play can be another early sign of autism. Lack of imitation. Imitation is a key part of learning and social interaction. Children with autism may not imitate actions or gestures, such as waving goodbye or clapping hands. This can be an important indicator for parents to observe. Limited use of gestures. Children with autism may not use gestures to communicate, such as pointing to objects or showing things to others. This limited use of non-verbal communication can be a significant sign of autism. Lack of pretend play. Pretend play is an important part of childhood development. Children with autism may not engage in pretend play or use toys in imaginative ways. This can be another early sign that parents should be aware of. Difficulty following gaze. Children with autism may have difficulty following another person's gaze or looking where others point. This can affect their ability to engage in shared attention and social interactions. Limited interest in peers. Children with autism may show limited interest in other children and may not initiate play. This can be a significant indicator of social difficulties associated with autism. Difficulty understanding social cues. Children with autism may have difficulty understanding social cues and norms. They might not respond appropriately to social situations, which can be a key sign for parents to observe. Communication is often delayed or develops differently in children with autism. Here are a few signs to watch for. Delayed speech or no speech at all. Many children with autism may not start talking by the typical milestones, and some may not speak at all. Repetitive language. If they do speak, children with autism might repeat phrases or words, a behavior known as echolalia. Unusual tone or rhythm. Their speech may have a flat, robotic, or sing-song quality. Obsessive interests. Children with autism might have intense, focused interests, often lining up toys or objects in a specific order. Sensory sensitivities. They may be overly sensitive to sounds, lights, or textures. Early intervention can make a significant difference. If you notice any of these signs, consult a healthcare professional for an evaluation. With the right support, children with autism can thrive and reach their full potential. Children with autism may also exhibit repetitive behaviors or have strong sensory preferences. Repetitive movements. Common repetitive behaviors include hand flapping, rocking, or spinning. These movements can be a way for children to self-soothe or manage their sensory input. Fixation on certain objects. They might be intensely focused on specific toys or activities, often playing in ways that seem unconventional, like lining up toys. This intense focus can sometimes make it difficult for them to shift their attention to other activities or tasks. Sensory sensitivities. Children with autism may be hypersensitive or undersensitive to sensory stimuli, such as loud noises, bright lights, or certain textures. For example, a child might cover their ears to block out overwhelming sounds or squint at bright lights. They might also seek out certain textures that they find comforting or avoid those that they find uncomfortable. Sensory tools. To help manage these sensitivities, many children with autism use sensory tools. These can include noise-canceling headphones to reduce auditory input, sensory toys to provide comforting textures, or weighted blankets to offer a sense of security. Creating a sensory-friendly environment. Creating a sensory-friendly environment can also be beneficial. This might involve setting up a quiet space where the child can retreat when feeling overwhelmed, providing a variety of sensory activities, or using tools like sensory swings to help them regulate their sensory input. Support systems. Support from therapists, teachers, and family members can make a significant difference. Working together, they can help the child navigate their sensory sensitivities and develop strategies to manage them effectively. Positive outcomes. With the right support and understanding, children with autism can thrive. They can learn to manage their sensory sensitivities and engage in activities that bring them joy and fulfillment. Playtime behaviors can also give important clues, such as a lack of pretend play. Most children engage in imaginative or pretend play by the age of 2, but those with autism might not show interest in this kind of activity. They may prefer to play alone or focus intently on specific toys. They may also have difficulty with changes, showing a strong preference for routine and difficulty coping with changes. Repetitive behaviors are another common sign. This can include actions like hand flapping, rocking, or repeating the same phrases. Sensory sensitivities are also prevalent. Children with autism might be overly sensitive to sounds, lights, or textures. They may avoid eye contact and have difficulty responding to their name. Self-soothing behaviors like using sensory toys or engaging in repetitive actions can help them manage their sensitivities. Sensory activities and toys can be beneficial in helping them cope with their environment. A structured environment with a consistent routine can greatly support their development and well-being. Early intervention and support are crucial in helping children with autism navigate their world and reach their goal. If you notice any of these early signs, it's important to consult a pediatrician. Early detection is crucial in understanding and supporting your child's unique needs. Pediatricians can provide initial assessments and guide you on the next steps to take. You may also want to seek advice from a specialist in child development. These professionals have the expertise to conduct more detailed evaluations and can offer tailored recommendations for your child. They can help identify specific areas where your child may need support and suggest appropriate interventions. Educating yourself about autism is another important step. There are many resources available, including books, online articles, and support groups. Connecting with other parents who have similar experiences can provide valuable insights and emotional support. Sharing your journey with others can make a significant difference. Early diagnosis and intervention can make a big difference in supporting your child's development. Various therapies, such as speech therapy, occupational therapy, and behavioral therapy, can be beneficial. These therapies are designed to address specific challenges and help your child develop essential skills. It's important to remember that autism isn't something that can be cured, but with the right support, children can learn, grow, and thrive. Each child is unique, and progress may vary, but with patience and dedication, significant improvements can be made. Building a strong support system is key. Involve family members, friends, and educators in your child's development plan. Consistent support from a loving and understanding network can greatly enhance your child's progress and well-being. Schools and educational institutions also play a vital role. Work closely with teachers and school staff to ensure they understand your child's needs and can provide the necessary accommodations. An individualized education plan, IEP, can be an effective tool in this process. Stay proactive and keep learning. Attend workshops, seminars, and training sessions to stay updated on the latest research and strategies in autism care. Continuous learning will empower you to better support your child. Remember, you are not alone in this journey. With the right resources, support, and dedication, you can help your child reach their full potential. Celebrate every milestone, no matter how small, and cherish the moments of joy and progress along the way. Thank you for watching. If you found this video helpful, please like, subscribe, and share to spread awareness. Early identification of autism is critical to helping children reach their full potential. Feel free to drop any questions in the comments below. Remember, every child is unique, and early intervention can make a significant difference in their development. By recognizing the early signs of autism, you can seek the necessary support and resources to help your child thrive. We encourage you to stay informed and proactive in your child's developmental milestone. Thank you for being part of this important conversation. Together we can create a more inclusive and supportive environment for all children. Don't forget to check out our other videos for more information and resources on autism and child development. Your engagement and support can make a world of difference. Thank you for watching and being part of this journey.